Well, the difference between an all-on-4 set of teeth and a traditional implant, a traditional implant is basically a scenario where we're replacing just one or two or maybe three teeth. The difference between that and an all-on-4 is a scenario where we're replacing all of the teeth. So we're able to replace your entire set of teeth with 4 implants. Sometimes we can use a few more implants, sometimes we can use less implants, but the traditional way of doing the all-on-4 is like the name implies, all of your teeth on 4 implants. Patients often think that we place a single implant for every tooth that you're missing. Now, back in the early days of dental implants, we used to do it that way, but we found out that that wasn't the best way to do it, that implants would fail and there would be a lot of bone loss. Now we utilize the concept of placing just 4 implants in order to replace your entire set of teeth, and that is what's given us the success and the dependability and the flexibility to restore people's mouth in a very predictable way. The ideal candidate for the all-on-4 procedure are people that are facing losing their teeth or have lost all of their teeth. Oftentimes these people have gone years and years and years watching their dentition and their teeth break down. Oftentimes people come to me in pain, frustrated because they can't chew or eat anymore, or they're socially embarrassed because they don't want people to see their smile. I had a patient 2 years ago whose grandkids were starting to question and make fun of his teeth, and he was so embarrassed, and it was a kind of a heart-wrenching story. And he came to me saying, "Dr. Thompson, we have got to do something to give me my smile back." And we were able to perform the all-on-4 procedure. He loved his smile. He smiled nonstop, and it basically changed his life, and he laughs and jokes and kids with his grandkids more than ever before. And so it was a very transforming procedure, very rewarding for me as well.